My final guests today are two people on the front lines of pandemic response and treatment research. Dr. Wayne Riley is president of the SUNY Downstate Health Sciences University, and Dr. Joe Kerschner is dean of the School of Medicine and executive vice president of the Medical College of Wisconsin. Welcome to you both. Thank you for your patience with whatever happened there. But let me just start and ask you, Dr. Kerschner, how has COVID-19 impacted your role, your community, your teams, and the people you're training and working with?
Well, I think we've all had to really adjust our world in a huge way as the pandemic has swept across our communities. For us here in Milwaukee, Wisconsin, and at the Medical College of Wisconsin with our hospital partners, we've had to change everything that we've done. We've been on the front lines with working with our community to provide access and resources to help with those who have been primarily affected by the pandemic. But we also have a very large research enterprise here at the Medical College of Wisconsin, and we've shifted many of our resources to be able to work on this pandemic and work on solutions for this. We worked with our communities to set up a field hospital and to support education of our business leaders, our education leaders. And as a health science university, we obviously have had a lot of our students and learners impacted in ways that I will certainly say as our physician learners will be something that they remember for the rest of their careers.
You know, I mean, before I move to Dr. Riley, you know, one of the things, I was out in Wisconsin not too long ago, and I know that you've done a lot of work into reaching some communities that have been, I don't know how to put it, I'm not good at health talk, but sort of skeptical of clinical trials. And if you kind of look at clinical trials around the nation, you know, to some degree, they're very populated by, folks like me, not as well populated by others. But I know that you've been working on, getting trusted figures and vote. So I'm just interested in how are you dealing with the clinical trial scene, and are you pleased with the direction and inclusion in that scene?
That I don't think is only germane to the COVID-19 pandemic, but is certainly an issue that we have in our entire biomedical research enterprise as it relates to having greater diversity and greater inclusion to be able to have the most widespread understanding of our results that we're doing in clinical research. We have an entity here at the Medical College of Wisconsin in the School of Medicine called Advancing a Healthier Wisconsin Foundation. It's an amazing resource for our research and education enterprises. And one of the things we did immediately as this COVID-19 pandemic started sweeping the nation is with the director of our HW Foundation, Jesse Ehrenfeld, we looked at a way in which we could allocate millions of dollars in resources for clinical trials that would specifically get to the less advantaged individuals of our community. So we targeted clinical trials and education aspects of these dollars to a diverse community, communities that we know have been especially hard hit by the pandemic, our African American, Black, and Latinx communities. And within Wisconsin and Milwaukee, I think those resources have made a substantial difference. They've helped on the education front. They've helped with us to design some of the responses. Some of the results of this and the data for this is still coming in, but we're glad as an academic institution that we were able to connect with our community in that fashion.
Dr. Riley, let me ask you a similar question, but on the front that, I keep reminding people, we're not just having a pandemic right now, we're having one of the greatest employment and economic crises since the Great Depression. And we have a crisis of identity and divide, police brutality, and just systemic racism in this country, which is another part of this. And so sometimes it's perhaps unfair to look at an institution like yours and say, what are you doing about it? Because it's such a big problem. But I am interested in how you think about reaching these communities that we're not reaching on things like clinical trials and inclusion in health and getting to different outcomes. Sorry to be long-winded, but I just think it's such an important question, and I know you've been working on it.
Great, Steve. Great to be with you, and a salute to Hill for putting this together. Delighted to be with my distinguished colleague, Dr. Kerschner. Look, here in Brooklyn, where we are, Central Brooklyn is predominantly African-American, Afro-Caribbean. So we have been in the eye of the storm, if you will, in terms of dealing with the pandemic most recently. But before the time of the pandemic, we have been taking care of folks who have high rates of the pre-existing conditions that we all now know about: heart disease, hypertension, kidney disease, cancer, et cetera. And so, our daily work as a safety net hospital posited in a great health sciences university with training in medicine, nursing, public health, and the health professions is something that's critical and in our DNA here in Central Brooklyn. Now, during the pandemic, we had to up our game. It was our great Governor Cuomo, and our health commissioner who tapped us to become a COVID-only hospital for a period of time. And that was critically important to serve in the community here in Central Brooklyn. And as we now know, we had major impact. Most of the cases in Brooklyn came from 2 contiguous zip codes to where we all work, study, and conduct research. So again, this is not something different than what we had done before, but I would argue that we had to up our game. We had to increase our focus, and obviously, during this time of pandemic, we think we made a major impact, as other institutions in New York City did, but particularly here in Brooklyn.
I'm going to ask you both this, and Dr. Riley, I just want to ask you, and again, I'm probably going to stick my foot in it, but do the folks what is the morale of your team? What is the morale of those people on the front line who are dealing with this? I know they're exhausted. I'm just and as you're training new people, are new people still coming in this time? You guys are educational institutions. Do you still find people lining up to go into this field? What is the state of play with morale and enthusiasm for going to medical colleges and being part of the front line of health in America? Dr. Riley?
Well, on August 19th, our morale is much better than it was on March 18th. Back in March, we were sort of right in the belly of the beast, you will. We had high numbers of patients. We had sort of spotty supply shortages. We never ran out of any critical PPE. I want to make that clear. But we did get kind of low in our inventory, as did other hospitals. I know Dr. Kerschner will attest to that as well. That PPE was a frustrating thing on a daily basis for me as the leader of this institution, to make sure that I was activating all my channels to get the critical PPE, whether it be gowns, face shields, et cetera, the reagents to conduct the test, the testing platforms. Again, morale is good now, and New York is really is a textbook case of success. Our infection rate is under the R0 at 0.7. We've at the lowest number of cases we've had since pre-pandemic. Here at our teaching hospital, University Hospital Brooklyn, I get a daily report. We only had 1 patient in the hospital with COVID, 1, at a time when we had almost 300 back in April. So again, we've made progress. Morale is good, but people are worried about what's going to happen. And again, what I've tried to do is to make sure that we express our appreciation to our caregivers, that we give them time off now that it's a little slower, that we've already begun the planning. As I know Dr. Kerschner will tell you, what happens when the confluence of the flu season coming up sort of interacts with the COVID situation. So I know he's been in meetings just like I have, preparing for the period between Labor Day and Thanksgiving is going to be very critical for this country.
Dr. Kerschner, what's the scene like in Wisconsin? And also, are young people still choosing to go into this profession?
Yes, so I'll just punctuate the comments by my colleague, and certainly would agree with everything that Dr. Riley has said. I would just really say that one of the enormous privileges of having these jobs, these roles as a dean of a medical school, is to interact with the wonderful people who are still in large numbers choosing to join our ranks, to be on the front lines, even in the facing of a pandemic such as this. The good people of the state of Wisconsin are people that pull together during hard times. We have a long history of doing so. And this has been another example of that. People from all walks of life have pulled together to really meet the needs where they are. Within our community, our students and learners have been at some of the forefront of this. They've led an effort in which the Medical College of Wisconsin, along with others, have produced face coverings, over 3 million face coverings that we've been able to hand out to people in greatest need in our community here in Milwaukee and Southeast Wisconsin. But the students, we've had the same number of applications that we normally would have for our medical school over this past admission cycle to this point. The students who are on the clinical wards were anxious to get back to the wards and help. You know, there was a period of time, as Dr. Riley noted, that we had to actually pull some of the students back because of PPE considerations, and as we were sort of organizing what the best way to have them interdigitate with our clinical care teams. But they are all back and working in the clinical arenas. We've got our full class of students in all of our health science disciplines receiving some degree of in-person instruction. Some of them are getting digital instruction in other ways. So we're really pleased with the way that our people have pitched in. And again, my hat is off to the young people. They are our future for sure. And when you have a chance to sort of rub elbows with those people who are going to be caring for us in the next decades to come, I will say that this country, and certainly the healthcare environment here in this country, is in a good place with these idealistic, hardworking, energetic individuals that we get the good fortune to help educate here at our medical institutions.
That's wonderful. Let me ask you, I have a really, really good audience question coming, much better framed than I could frame. So we're going to do that in a second. But you belong to a network, and I'm very happy you're both here, despite the network. But I'm interested in best and promising practices, things you've discovered, new frames of patient care or innovations, or things that you've found in terms of therapeutics and potential partnerships. I know many of you are partnering with some pharmaceutical firms in this. How do you show and tell? How do you learn from each other within this network? Because I think, having the gains that one institution makes get shared with the other. And so I know this may be, just sort of a nuts and bolts question, Dr. Riley, but I am really interested in this because otherwise you end up perhaps with unevenness in the country. We've had an uneven rollout of the COVID crisis. How does one part of the country that wasn't hit on the front end, like Brooklyn was, learn from you?
Well, again, as Dr. Kerschner will tell you, the practice of medicine in all the health professions is very collegial. We may compete against each other, in some of the U.S. News and World Report schemes and all that, but it is not uncommon for our faculty, and I know Dr. Kerschner will tell you, to pick up the phone or reach out by email or Skype to a colleague across the country. Hey, tell us what you're doing in terms of ventilator management. I got calls from Houston, Texas, where I trained as a physician, because they knew what we had gone through here in New York. So on a daily basis, we are incredibly collegial. We share best practices. For example, you said, what did we learn early on in terms of taking care of COVID patients that we didn't know at the beginning of this? And Dr. Kerschner will tell you, we learned that a simple maneuver, turning patients over on their stomach, helped to prevent, in some cases, the need for them to go into a ventilator. But even if they were on a ventilator, they ended up being on the ventilator less time. They tended to do better, et cetera. So that was one thing that kind of, if you will, blew my mind, that a simple proning, as we call it, or putting patients on their stomach, helped to better oxygenate areas of the lung that had been affected by COVID. The next thing, in terms of, we always wait for the data. We did not take the bait on hydroxychloroquine, and I know Dr. Kerschner will tell you, we were always skeptical. Those of us who know this drug were skeptical that it would be helpful. And guess what? The data did prove that it does not work. But steroids, the use of dexamethasone, an IV, very potent steroid, was another sort of godsend as we went through this. So the combination of testing them, get people tested, get the positive result. If they needed to come in the hospital, put them in the hospital, give them high flow oxygen, put them on their belly, give them steroids, was immediately impactful in terms of how we took care of patients on a daily basis. And as Dr. Kerschner will tell you, we shared that knowledge all over the country, whether it was in the middle of the night with phone with chatting and texting our colleagues. That's the way that we work. That's the way we roll, if you will, in healthcare. And I'll go back to something you said earlier, Steve. We have to develop a healthcare and public health infrastructure as good as the young men and women who are joining us to study medicine, nursing, and the other health professions. We are doing a disservice to these fantastic people who are still choosing to come to places like Medical College of Wisconsin and SUNY Downstate Health Sciences University. And that's what Joe and I will be agitating for. We've got to fix things for these good people who are going to end up taking care of us and our loved ones, and be prepared for the next whatever, whether it's a man-made natural disaster or the next pandemic.
Joe Kerschner, I'd ask you, and not only how does the show and tell system work, but have you been able to show and tell anything in your center?
Yeah, so just would corroborate the things that my colleague, Dr. Riley, has said. One of the things that we've really been involved in here is convalescent plasma and how that can be utilized for patients who have recovered from COVID-19 and be an adjunct to the therapy as well. And then just one other thing that I will say, and hopefully it allows people to have confidence in their academic health centers and the way in which we do collaborate, as Dr. Riley has said. But the AAMC, the Association of American Medical Colleges, is an umbrella organization over our institutions, our teaching hospitals, and our medical schools here in the United States, and our colleagues north of the border in Canada participate as well. And I will tell you that the AAMC has organized a way in which the deans of all of our medical schools have been on a call on a Monday night, basically every Monday night for an hour or more since this pandemic started. So the leaders of our academic institutions, who, by the way, care for the vast majority of the complex and most ill patients, not only in this pandemic, but in other areas as well, have been collaborating on a phone call every Monday night during this entire pandemic to make sure that we're sharing best practices, ideas, getting our colleagues best information. I will say we can oftentimes talk about what things could be happening better in our society, our healthcare system. You have it, but in watching my colleagues as leaders participate with all the other things that they have on their plate, and most of us have been putting in, 12, 14, 16-hour days, really 7 days a week during this pandemic, to have people dedicate that amount of time with their leader colleagues has just been an inspiration for me personally.
Well, that's really heartening to hear, and I just love hearing like how the infrastructure of communication is taking place. We have Amarina is going to give you folks a question.
My name is Amo Trigg. I am the Manager of Program Evaluation and Educational Research at the University of Arizona College of Medicine, Phoenix. My question for the panel is that educational research has picked up traction in recent months because of the push for publications and novel research on COVID-19 and its adaptations across the medical education continuum. Is there a possibility for a national database to be collected of these adaptations and/or a national survey to be sent to medical students and residents to learn from their experiences with these adaptations?
We should invite her on in the next panel. But let me ask Joe. We'll give you, and then to Dr. Riley. This idea of a national database, and also she asked a very interesting question about, the sort of, peer review and the publications. This was a point made earlier that this process doesn't work fast. It's not Operation Warp Speed. So any thoughts on that? And then Dr. Riley?
So just starting, I will say, just to answer that last question first, I have been impressed with our colleagues who run journals, and the speed. You're right; it just does take a long time generally to get things into the medical literature. But the speed with which we've gotten really excellent data and review into the medical literature as it relates to this pandemic has been remarkable. To the question at hand. One of my other hats I wear, I'm the chair of the board of the AAMC. So if you send me an email at jkerschner at mcw.edu. I promise you that this idea will be taken up by the AAMC, and we will catalyze this. There are individuals who are working very hard to ensure that we're able to collect all of the best data and resources and learning opportunities. And the AAMC, which really is the organization that hopefully takes our pre-med students, our medical students, and transitions them into residency, this is right in the sweet spot for that organization. So just send me an email. Our colleagues at the AAMC will take this up, and I can promise you we can bring something forward along this line.
Well, thank you very much. Dr. Wayne Riley, you get the last word.
Well, again, that was a terrific question, and it was fortuitous that I'm sharing the panel with the chairman of the board. Of the
I had no
association.
idea he was the chairman. I should have been nicer.
Yeah, as they say down south, this is high cotton, right, with Kerschner. So, but no, that's a great question. We need more data, and the ability to have data collection, rigorous access to data, easy access to data has been critical to this whole effort that we've been going through for the last 6 months. For example, the use of remdesivir, it was something in terms of the speed at which the data was generated was very helpful. That was yet another therapeutic that we got data sort of in the middle of the storm that helped us to adjust our treatment protocols along the lines I had just spoken of. So no, the AAMC in particular, great storied organization that is to connect all of our academic health science centers and medical schools around the country for this type of thing, for data exchange, for best practice sharing, for advocacy on behalf of healthcare issues for the American people and for the communities where we all sit.
Well, I want to thank you both, Dr. Wayne Riley, president of SUNY Downstate Health Sciences University, and Joe Kerschner, who is the dean of the School of Medicine and provost and executive vice president, professor of Otolaryngology, Microbiology, and Immunology at the Medical College of Wisconsin, and apparently the chairman of AAMC, which I really didn't know. He got on despite that distinguished role. But thank you both so much for sharing. Look, I mean, I use humor to kind of deal with some of these issues. I know that this is a serious time for people and that there are hardships out there and impacts and people who are sick, so many who have died, and that's why we are put a priority, not only today, but in many of the Hill's other events and programs to continue to focus on these issues. And I can't thank you enough for sharing with us part of the infrastructure of how we're going to get through this to the other side.
Great.
Happy to.
Great to be with you.
Thank you.